Candidates, the next area we will discuss, crime and safety. Please take a look at the monitors again. Charleston County Coroner Bobbi Jo O'Neill addressed the increase in drug overdoses in our community. Let's listen to what she had to say.
We have lost way too many of our citizens, our family, our friends, and that is continuing to happen at really unprecedented numbers.
Now, she goes on to say that this is not just a problem on the peninsula of Charleston. It affects every demographic. Recent measures taken across the country include offering drug testing strips on college campuses and making Narcan more widely available. Mr. Cogswell, we begin with you. You have 60 seconds to respond. The question is, would you support similar harm reduction strategies? And what else would you do if elected mayor to address this growing crisis of drug overdoses?
Yes, I would say absolutely anything we can do to address this crisis, and it is a crisis, we should do. And I'm proud to, when I was in the legislature, to have been part of legislation that made South Carolina one of the toughest penalties for drug trafficking, particularly in fentanyl. So we've dealt with it as aggressively as we can at the state level, and certainly at the local level. We need to make sure the basic rule of law is enforced. And you're seeing it all over the city, as you pointed out, and it's really tragic. I mean, just the other day, or a couple of months ago actually, a sometime columnist for the newspaper sent me pictures of drug overdoses that were occurring just outside where my office is on the east side. And it's tragic. I mean, it really is tragic. So again, it starts with the low-level drug dealers, and you have to enforce the basic rule of law to protect our citizens and make everybody feel safe. Thank you.
Mr. Cogswell, thank you. Mr. Middleton, can you tell us specifically what you would do if elected mayor to address this crisis?
Yes, I think the City of Charleston, the police department, and other nonprofit organizations and the medical industry are doing good things now. So as mayor, I think we need to make sure we focus on having boots on the ground in terms of community engagement and the education phases that are a part of it. We know where these issues are. There's no secret. And in fact, a lot of it is not just within those that are in college, but also throughout the community. So it's very important that we do not treat these people as if something's wrong with them, but we need to go where they are to provide the services that they need and their family needs, providing access to opportunities from education to job training, etc., and not look down on them. As mayor of the city of Charleston, we will be right where they are and have those nonprofit organizations, trusted agencies within our community to work day in and day out, not because it's popular, but because it's the right thing to do in and out of season. So as mayor of the Charleston, those are some things I would do.
Thank you, Mr. Middleton. Mr. Tecklenburg, the question is for you. Would you support similar harm reduction strategies, and what else would you do specifically if reelected to address the growing crisis of drug overdoses? You have 60 seconds to respond.
Well, it's a crisis not just in the city of Charleston, but the whole United States. Over 100,000 people died last year from drug overdoses, and mostly from opioids that had been added to other drugs that people were using. So sometimes they don't even know they're taking the opioids. So we formed a community collaborative. It's really led by Judge Brucey Hendricks. She's done an incredible job, including law enforcement and nonprofit agencies and the Charleston Center for Drug Addiction. That's been ongoing for a few years. But we recently received some funding specifically for opioid education and treatment. Our police department has been going around the city with training for Narcan, making Narcan available to our community. All our firefighters and police officers are equipped with Narcan to be able to respond, but we also need to get drug dealers off the street, and we're doing that as well.
Mr. Tecklenburg, thank you. Mr. Shayed, you have 60 seconds to respond. Same question.
Thank you. I served as a federal prosecutor for approximately 10 years here in Charleston, addressing the major drug dealers in our community. And I was very successful in identifying those folks, indicting them, prosecuting them, making sure they went to jail. But we have to look at this on a lower level, and we have to start thinking about not criminalizing the lower level folks who are involved in simple possession of drugs. We do have in the federal system a drug court. We also have on the probate level a drug court. that addresses these issues to provide these folks an opportunity with the resources that are available through those particular courts. I served with Judge Hendricks when she and I were both assistant U.S. attorneys. I know her capability. This is something very dear to her heart, and she's done an excellent job in the federal system of addressing this issue, and we just need to continue the programs that we have in place throughout the community in these different level of courts.
Mr. Shahid, thank you. Ms. Gadsden, your response. 60 seconds, please.
We're not going to arrest our way out of this issue. This is a mental health issue. And for me, this is an indicator that Charlestonians and folks in our region are going through a lot of pain. Folks turn to substances sometimes to medicate. So I believe that we need to take a closer look at our budget, make sure that we reinvest in health services, specifically mental health services. We're a city that boasts the distinction of having the MUSC hospital here. And while that hospital footprint grows, we need to make sure that folks are actually are receiving the benefit of having the type of healthcare environment we have here. But I do believe the city could reinvest in healthcare. We need to make sure that we also are not driving up the inequities that also run alongside of this growing problem. We need to make sure that we are funding mental health services and that we're not sending law enforcement to help out, but we're sending qualified, trained professionals who are trained to address that.
Ms. Gaston, thank you. Ms. Gammons, what would you do as mayor to address the growing crisis of drug overdoses specifically? You have 60 seconds to respond.
As mayor, I see it as a three-pronged issue: education, resources, and also law enforcement. So as mayor, education is crucial, working with our young students, working in the high schools and even the middle schools to inform them of the dangers of drug use. And then when it comes to law enforcement, again, additional training on what that means. Arresting those who are distributing drugs, and making sure those who are using drugs have the resources, have those family resources in place for them. And that's what I would do as mayor. Education, resources for family members, and also law enforcement properly trained, enforcing the law, and also bringing about this humanity to those who are addicted to drugs.